So I think my number one recommendation is you gotta advocate for your child. You are the families, parents, friends, you are the biggest advocate. You need to ask your question again and again if you feel like you didn't get the answers from the professionals. I would recommend for any family definitely writing down the questions. Often in the conversation you miss sort of very important questions you had in your mind, and writing them down is obviously very helpful because often the question you just wanted to ask and then your doctor left the room. So that's very important, writing down the question, discussing questions with family and friends. If a family feels it's too much burden for them to directly talk to their friends and families and extended families often about the diagnosis and about the treatment plan, ask the providers to do that for you. I mean, we are there to help facilitate communication. If you feel like in terms of treatment plan, you don't understand, give it to you in writing. So I think communication with the healthcare team is absolutely crucial. You need to feel as a family that you have access. And if you don't feel like you have access, you should ask for it. I feel like in a situation where your child has been diagnosed with a brain tumor, you have a right to have access to your care team on a regular basis. And each physician handles this very differently. Some give out their cell phone numbers, some give out their emails, some have you call their office. But in the end, you just need to advocate however you communicate with your team, that it is to your satisfaction and that you feel like you have the right access. And I feel like it works best in the setting where also if you realize as a physician, the family also respects that there are certain times where you just cannot talk, but then other times you make yourself available. You can set times with a physician and say, this is when I like to check in, or you can basically, when your child is being admitted for routine chemotherapy, you can check in before and say, we are admitted, I need an hour of your time. And so that normally works very well if it's not something urgent that needs to be discussed, but if it's something where you just need to feel like you have a constant connection to your physician. So setting up times, just talking about it with your physician. How do we communicate? How do I reach you best? And each physician have their own style, but then at least you know what the style is and then you can react to it. And if I feel like if families don't feel like the connection they need, then they need to voice that, and often then things can be changed.